Welcome to Understanding the Human Condition with your host, Dr. James Flowers.
I was just saying how much I love your voice, Robin.
Oh, thank you.
How are you?
I'm good. How are you?
Well, it's sunny outside and warming up.
You're back from vacation.
I'm back from vacation.
Yeah.
And I'm super happy that Dr. Catherine Karmel is with us. She's a good friend of mine, personal friend,
Yes.
and works as a consultant, I guess, a provider with us at J. Flowers Health Institute. So welcome.
Thank you. I'm so excited to be here. I've been watching all of the podcasts.
Have you?
Aw, thank
You
you.
actually have?
I really
Yeah.
actually
I love
have.
it.
I watch them and listen when I'm on my walks.
Nice.
Since I can never get in touch with you anymore.
Exactly.
Which
Usually
one's
I
your
call him
favorite
on
so
Sunday.
far? Which one?
Usually we were having our Sunday morning
I know.
walk together.
We have to get back to that.
My favorite so far,
Put you on the spot.
of course, Rex Marco was incredible and
that was
so
a good
inspiring.
Wasn't he amazing?
Yes.
Yeah.
And
Yeah.
so much overlap with what we're doing with patients. So
Yeah.
I would love to get him involved if we can.
I would too. I've told him that, and
Yeah.
he said just
When
reach
he's
out.
ready.
So we need
Yeah.
to talk about how to
Yes.
do that and what to do, because it was my favorite so far as well.
Right.
But Dr.
And-
Landau also,
Oh,
I mean,
yeah.
for me, when I watch them, it's interesting because you're finding people to interview or to talk with on your podcast, and many of us have overlapping ideas and approaches and philosophies. And like
Yeah.
with Dr. Landau, a lot of my experience and my perspective is
Yeah.
similar
Similar
to
to
hers for similar but different experiences.
I
you know.
completely see that.
Yeah.
Yeah. Y'all
Yeah.
are very similar. And of course, she's from South Africa, right?
Yes.
But a little bit different experience. But yeah, you guys, I think y'all's philosophy is probably really very similar.
I have a little bio to read, if I may.
Oh, sure.
Oh,
And
Go
then we'll
ahead.
get
just
off to some
chatting.
more. I know. Well, for those who aren't aware of who Dr. Catherine Karmel is,
Yeah.
Catherine Karmel is a medical doctor with a specialty in gynecology. She is known as the global gynecologist because she treats the whole person and not just the symptoms. She incorporates the physical, emotional, and spiritual aspect of a patient in her treatment and diagnosis. Dr. Karmel has been in private practice since 1995 and works in the Texas Medical Center focusing on women's health care. She is also the gynecologic consultant for the Triangle Area Network clinics, which provide care to the underserved areas of Beaumont and Orange, Texas. She has been practicing for 25 years, and each year she grows more passionate about medicine and taking care of her patients.
And it
Welcome.
shows.
Thank you.
It does.
Thank you.
So do you do the Beaumont and Orange at Triangle area with Dr. Schrader?
I do.
That's
yes.
so cool. I didn't know that.
Yes, he's been doing it for so many years. So this is a clinic that started out as a free, well, it is a free clinic. It's federally funded, but it started out as an AIDS clinic for
Yeah.
many years, and now it's expanded to include women's health and children and wellness.
That's so
yeah.
cool. Do you go every week?
No,
No,
no, every other week.
Good.
But
That's so cool.
It's really
Yeah.
nice that you do that.
it's fun.
That
They're
is
really, the
amazing.
people are so awesome.
Yeah.
Really nice.
I know, and y'all are incredible for doing that every week.
Mm-hmm.
So the title today is Treating the Whole Person with the Global Gynecologist. What is a global gynecologist? Because I always refer to you as a gynotherapist, which we'll talk about later, but talk about global gynecology.
Well, when people ask me what I do or what's different about my practice, it's very hard to put my finger on it. And so I was trying to come up with a description. Global, the definition of global is of or relating to the entire world. So approaching a patient in a global fashion means you're approaching them in terms of who they are as a person, whether it's emotional, physical, spiritual, cultural. All of those factors come into play. And so you have to evaluate globally to treat locally.
That's right.
So you can't just treat a reproductive organ. A lot of things go into that.
That's right.
So it's really
So cool.
it's like holistic, except that I think the word holistic has been pirated. So
Yeah.
many
Yeah.
people.
It has. And overused and
Overused.
overused. You
Exactly.
should trademark quick.
You should.
The global gynecologist.
I will.
Yeah.
We give out lollipops too.
Exactly. You do.
How did you
I'll have it
choose?
stamped. The
Yeah.
global
How
There
did
you
you
go.
choose your career? Did you choose it, or did it choose you?
Well, that's an interesting question. So I would say both. No, I would say it chose me. So when I was a kid growing up, I used to think about being a doctor, and there's a famous picture in our family lore of me curled up in a chair, and I'd fallen asleep reading a book called Great Women of Medicine.
Oh, wow.
And so my father had a blown up poster size of that, even when he was in his 80s before he died. So that was always something interesting. And then I realized as I got older that, you know, I was always interested in medicine, but I was also interested in travel and language and literature and music and spirituality. And so during college, I was a comparative literature major, and I played the violin, so that's about as liberal artsy as you can get.
Wow.
I realized that you could study things that are fun and not, you know, torturous like chemistry.
Right.
But then I had the opportunity to work in a medical clinic in India when I was in college. I took a semester off.
That's awesome.
And at that time, I just realized that that was what I was meant to be.
I love that.
So did you switch majors, or did you finish with liberal arts and then?
Yes. So I came back. I spent the whole year abroad. I studied in France and Italy, and it was a nice, wonderful time. And then I came back, and I just had one semester left, and I started my pre-med. So I had to go back for a couple years, and there I was with the 250 freshmen in chemistry. And that was
exactly.
That was challenging.
And your father was a physician.
Psychologist. Both of my parents were PhD psychologists.
That's right, yeah.
So is my sister.
Yes.
So is my best girlfriend. She's a psychoanalyst from college. And my best girlfriend here is a therapist. So I'm inundated with psychology.
She calls
and your best
them,
boyfriend.
There you go.
That's right.
true. You called them on the phone the other day intellectual hippies.
Sometimes I like to call them non-drug doing hippies. Because when people think of hippies, they think, you know, like peace and love, let's get high or whatever. But yeah, so we moved to North Carolina when I was 7. And it was in Greensboro, North Carolina. There wasn't a big intellectual community there. But my parents were great readers and writers. They wrote textbooks together about psychology and educational testing. And we had our own garden. My mother made her own granola and yogurt. And
so cool.
And we weren't allowed to have medications,
right?
Which I can get to in a minute. But so we were exposed to a lot of different things and a lot of different kind of people. And I think that my mother also had a degree from the Art Institute in Chicago, so there was a lot of art in our house, and then I played music. So all of these things surrounded me when I was growing up, and I think it's contributed a lot to helping me be a better doctor. So.
Yeah.
You know, you're such a big part of what we do at J. Flowers Health Institute in our comprehensive diagnostic evaluations program, and then also in our wellness program. However, I always tell Robin and friends and everyone, I brag on you all the time, because when women finish the evaluation, we always say, tell us about your experience and how was your experience? And they never say, Dr. Flowers was amazing. Oh my gosh, you were brilliant. Every single woman says, oh my gosh, I'm coming back for Dr. Karmel.
They love you.
Really?
You're a big hit with our patients.
I learned more from Dr. Karmel than anything else, because you bring in the medicine and you bring in the therapy piece of it, including hypnotherapy. So I lost my place here. We were talking about psychology is a big part of your practice, or psychology is a big part of your practice. And I know that comes from your parents and your background and your upbringing, but I love the way that you fit that in with every single patient. And I love the fact that you do hypnotherapy, because the patients with whom you've done it with ours have progressed so much, even in the short time that they're with us. So tell us a little bit about the psychology in your practice.
Well, first of all, thank you for the compliments. And, you know,
all true.
It's
true.
I don't think about things like that. You know, I've always been very sensitive to people, and I always felt that I could easily connect with just about anyone, regardless of their gender, race, age, you know. All of my travels all over the world, I've just felt like that, and I think you're similar in that way.
Yes.
But then as I got older, I realized that I had a gift for healing and a desire to help people. But healing and treating patients can't happen without a personal connection. So it's a nice combination, and I think that's really important, because when I meet a patient, first of all, I meet them with their clothes on. Before we do any kind of an exam.
I'm listening. I just had an emergency phone call, so I'm going to text back.
Okay.
Keep going.
Sure.
Okay. So it's important to establish a rapport with a patient and the trust before you can proceed towards any diagnostics or examination or evaluation.
So they open up.
Right. So I think that's what a lot of women maybe were missing with their other gynecology appointments. Maybe people are in a hurry. Boom, boom, boom. You got to get out of there.
Yeah.
But as far as the hypnosis, so my hippie parents were into breastfeeding and Lamaze, labor instruction back when it wasn't popular. And so since they didn't like us to take medications or eat junk food, by the way, which I hated until I became an adult, when I remember during one period I was having headaches and my father hypnotized me for the pain to go away if I was having recurrent headaches. And so that was my first exposure. And then as time went on, he was using it in his practice. And so we talked a lot about it. And this was a time when the American Society for Clinical Hypnosis only accepted MDs, and then they added PhD psychologists.
Okay.
So it was a pretty rigorous training at that time. But then when I decided that I wanted to go to medical school, I had to change the way that my brain worked. And I had to spend many hours memorizing, which is not what literature studies are about. It's more about thinking and coming up with ideas. And so instead of taking Adderall, because that wasn't available so widely then, I did hypnosis for memory and concentration. And so I went to another psychologist, friend of my father's, and we did several sessions in his office, and then we made tapes that I used all the way through residency and board exams, because, you know, when you're a doctor, you never stop having to take exams.
Right.
Even now, we have every year board renewal. So that's how I got into it.
Wow.
So, and it's just amazing. It's an amazing tool.
Yeah. Yeah.
So you mentioned that you had chronic pain not chronic pain, but a pain as a child, and your dad did hypnosis with you.
Yes.
What was your pain, and what happened with that?
Well, I'm not really sure why I was having headaches, but I do know that he got rid of them.
Yeah.
Wow.
But being a psychologist, he was also very good at reading people, and he was a Freudian psychologist. My mother was a child psychologist with an interest in Piaget.
Wow.
So they ended up getting divorced, of course, because you can see totally different.
Freud, yes.
But I can tell a funny story about the psychological environment. One thing is that we never got spanked.
Yeah.
We got analyzed. And so when we got in trouble, literally
Brutal.
it could be an hour or two sitting in the study with them discussing what you did, why you did it, what have you learned, how were you feeling when you did it. So I learned a lot about
How are you
that.
feeling
You're like,
now?
just spank
Yes.
me, get it over with.
Yeah.
Exactly, and that would have been me.
Right.
Yeah.
Yeah.
But then I remember, I think I was maybe around 11 or I think 4th grade, and so we had given my father a set of darts for Father's Day. And it was kind of a big deal, you know, we didn't grow up in a super fancy way at that time. So we had gotten him a really nice dart set, and it was summertime, so I was home. So I took the darts out one day, and I was playing with them, and I lost the yellow dart. And so I couldn't find it anywhere. So later that summer, I got strep throat, like lots of kids do. And I went to the doctor, and I got antibiotics, and then I just wasn't getting better. And I went back, and the doctor was like, well, we'll just give her more antibiotics. I don't know what's going on. And so finally, after about 10 days, which is a long time to have strep throat, my father came in, and he sat down, and he's like, Catherine, he's like, is something else going on that you'd like to talk to me about? And so the next thing you know, I just lost it, and I lost your yellow dart. And so I confessed the yellow dart, and boom, the next day I was fine.
Isn't that amazing?
It really is.
Yeah, it is.
Wow.
Our bodies keep the score.
Right.
Yeah.
And so, I mean, he was just trying to help me get better.
Sure.
But I think that stuck with me because I understand how we can internalize things.
Yeah.
And it's the same thing if a patient comes in, for example, someone comes in with recurrent vaginal infections, and they've taken 10 different treatments, and they've seen 4 different doctors, you know, and what's going on, and every test is negative, every culture is negative, but they keep having this discomfort and these infections, and it's torture. And then you really have to just dig deeper. I mean, maybe something else is going on. Maybe they're being abused at home, or maybe they are diabetic, or maybe they are very stressed out, or there could be so many things that play into it.
Yeah.
So that's part of the global approach, too.
Absolutely. You know, there's got to be a lot of stress as well in the work that you do, and working with women who are having issues. And then your husband is a cardiologist. So for your children, it must be a lot of stress being a child of a gynecologist and a cardiologist with psychologist grandparents.
Right?
Actually, no, but sometimes driving around in the car, I have two 17-year-old daughters and a 15-year-old son. They'll be like, Mom, stop being such a gynecologist. Oh my God, do you have to talk about the vagina again? You know?
I wondered if we were going to say
Yeah,
the V word in this.
Of course.
Exactly. Yeah.
And my husband's pretty laid back, so
Is he?
He is. Yeah.
yeah. But we are very therapy oriented. So
Absolutely. What do you guys do for fun in your house
in my house,
or outside of your home? But what is your family? What do you guys do to de-stress?
well, a lot of cooking and eating, especially in the last year.
Yeah.
So my inspiration is not as strong as it used to be, but especially at the beginning of the pandemic, I was making all kinds of fancy meals. You may have seen pictures of them.
I think I had a couple of the breakfasts.
Okay,
Yeah.
and we have a screened-in porch that we'll hang out there. And my we have family that lives next door. My 97-year-old father-in-law, who I
Aw.
adore, and
Yeah.
so they come over a lot. And
Lucky
he
you.
plays the piano, so music is a big part of my life.
And
violin.
you still play the violin.
Well, I started again since COVID. So I had Facebooked, messaged my old violin teacher who was from Duke when I was living in North Carolina. And she answered me 1 year later,
Wow.
which was last March. And so it was the pandemic, and I was stuck
Yeah.
at home, and we connected, and I said, you know what, I'm going to start playing my violin again.
Yeah.
And it had been 30 years.
Wow.
So she's 83,
That's so cool.
and we do FaceTime lessons
Oh,
every
I love
Sunday morning.
that.
Yep.
Wow.
So that's been my COVID perk.
Yeah. How was, clearly you had to close your practice for a while, but how did COVID affect your practice and your own psychological health?
You know, actually, I've been fine, thank God.
Yeah.
Partly because of my practice and my patients. I love what I do, and I love my patients.
Shows,
It's
yeah.
like going to a cocktail party every day.
Aw.
You know, you just get to hang out and talk to cool women.
Yeah.
Aw.
But, and with the practice, you know, of course, we've had to close intermittently. I think part of the reason why I feel more sane than some people is because I get to go to work and interact with people. But in terms of my patients, I would just say anxiety, 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 anxiety.
Yeah.
Because
Yeah.
so much uncertainty, so much, you know, the rug has been pulled out from everyone. And it's hard. You can't get back into your routine. So, and then especially people that may have had a tendency towards OCD behaviors, having to wash everything and clean everything, it really has been a significant issue
Yeah.
for so many people. And I'm still seeing them come in even now.
Yeah.
A lot of anxiety and stress.
Oh, yeah.
Well,
So-
this question is for you, Dr.
Okay.
Karmel, because for the audience to hear, why does J. Flowers Health Institute incorporate a gynecological exam as part of the comprehensive diagnostic evaluation?
Well, first of all, I only see the women that come in.
Right.
Just want to make sure that's clear.
right. Yes.
I have helped out some male patients along the way. I'm a licensed medical doctor, so that's okay to do. But I think that it's a nice window into what's happening on other levels. Just the same thing as the global gynecology. It's a window, and it's an opening for me to begin a dialogue with the patient. So we start and we talk about, as I said, we always talk in my office. So we start with just routine things. How old are you? You know, when was your last period? What are your periods like? And then as you begin talking about things like that, just familiar sort of normal things, then you can easily segue into other things that come up. So,
Well, and do you find that there's a lot of women, because this was my thought in the beginning when I heard that was part of the process, that there's just a lot of women out there who don't go to see their gynecologist on a regular basis.
Well, that is definitely true. But I think that also, a relationship with your gynecologist can and should be a very close relationship.
Mm-hmm.
And so many women suffer from, well, anxiety, but also low self-esteem
Mm-hmm.
or shame. And I'm sure you know Brene Brown. She's done amazing work in helping us understand about imperfection and accepting imperfection.
Absolutely. Yeah.
And women have a tendency to try to be perfectionists.
Mhm.
Even little girls, they
Yep.
want to have
Sure
the nice
do.
handwriting and they want to behave well in school.
Mm-hmm.
Yep.
So I think that's where it opens the door to so many things.
Mm-hmm.
And I think one of the other reasons that she looks at this global, or one of the reasons we do it at J Flowers is because of her belief in that global health, right? And my belief in that global health. But we also have talked that we both kind of share something else together, and that is we both kind of have this odd or not, but we have this sixth sense for diagnosing. And you talked a lot about that in your own career, and I've talked about it in my career, and having this kind of sixth sense. Tell me a little bit about that, and where do you think that comes from, and do you nurture it, and kind of, I'd love to know more about that.
Well, that's a great question. So to prepare for our podcast, since these are things I use, I looked up the definition. So sixth sense is the natural ability to know things before other people or to see things that others do not see. So what I think is that, and this is what I love about the J. Flowers Institute, really what it is you're taking all these different clues and you're bringing them together. So studying comparative literature, you had to study literature in different languages. You had to come up with your own theories. You had to bring philosophy, history, all these things in. So I learned how to weave things together, plus with the music background. And then the sixth sense, probably, if you dissected it, is taking all those signals and putting a puzzle together.
Right.
And so you don't know how you pick up on it, but meanwhile you meet me and you're picking up on so many different things, including the person's energy. And you're very empathetic and you can feel certain feelings that people have.
Right.
And so that's really why, to me, it's so exciting to work with Flowers Institute, the J. Flowers Institute. Because,
Thank you.
Well, I want to say this is so important because it's collaborative and medicine has changed so much and it's not collaborative. Everybody's in their own little office. We're under so many regulations that you don't get together and discuss patients like we used to.
Right.
Yeah.
We used to be in the doctor's dining room and we would meet and people would present cases, and
Yeah.
so I just love that collaboration.
Yeah. We do too. I mean, that's what makes this so successful. Even some of the larger hospital systems around the country that do assessment programs started when they were smaller and grew into these huge hospital systems. And when you grow that large and you can't go to the dining room all the time and you have 50 patients that you have to see, or even 25 patients in a day, you see the patient, you write the report, and you upload it to the chart, right? And then at the end of the evaluation or the assessment, someone kind of reads it and gives it to the patient and goes over it. And what I love about the way we collaborate is even though we can't see each other in person all the time, we get together on Zoom. Right,
Yeah.
like the rest of the world.
Every week.
But we get together every single week on Zoom, and it feels just like we're in the same room. So that's kind of cool.
That
doing
is, it's
Yeah.
awesome.
We have so many different providers in different fields, and we each have different perspectives.
Right.
And I also appreciate input that I might get from our nutritionist, Mo.
Yeah.
I think he's
Oh,
got
he's
amazing
amazing.
insight.
Yeah.
And then people will appreciate my insight. Sometimes it might even be about a male patient because we're discussing issues that are just human issues. I mean, we're all
Right.
humans are the same. The human condition is universal.
Mm-hmm.
So,
Yeah.
wait, I had something I wanted to say.
What was it?
About your travel and how
Yeah.
that's affected your.
No, it was about him and his sixth sense. Hold
Oh,
on.
was it?
Shoot, I forgot.
You know what I
That's
was going
okay,
to
we can
say
come back to it.
is it's weird that whether it's a sixth sense or whatever it is, you know how we kind of visualize things. I'm very visual. Is when I think about my sixth sense, and what you just said kind of hit the nail on the head for me, is sometimes I literally feel like my brain is clicking. It's like when I listen to someone, it's going tick, 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 like adding things.
Really?
Yeah, and it's almost like this little calculator coming up with an
Interesting.
algorithm or something.
Yeah.
And kind of feeding it in and coming out. So I don't know. That's the way I kind of visualize it for myself.
You know what?
Yeah.
What I was going to say is, you said when you listen to someone.
Yeah.
I think a lot of the sixth sense and a lot of being a helpful and good caretaker, provider, is listening. And listening and letting the patient say what they need to say.
Yes.
Because they tell you, patients will tell you, they tell you everything that you need to know, but you have to listen.
Right.
And so, like you were saying, a lot of times people are in a hurry and this boom, 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 here's your prescription, goodbye.
Right. Yeah, absolutely. Yeah.
So,
What's the best advice that you could give the female audience right now? Like one word of advice for their female health.
well,
I know what you told me earlier.
there's,
See a therapist.
I was going to say, call your shrink. There's not one word because it's so individualized, but I think that working on self-acceptance is paramount for women and girls. And it's a journey that we all go through, and a parent can definitely help with that. And a lot of parents can be critical of their children or send a message that makes the children less accepting of themselves. And if you have self-acceptance, then you can really just blossom into the person that...
That's the key, self-acceptance, right? And it's hard to get there.
Right.
Yes.
What are the ages of the patients? What's the youngest and the oldest that you accept?
Well, I see patients from adolescence through menopause and postmenopausal. I no longer do deliveries, so I did many years of OB, which I loved, but I had to give it up after having 3 of my own children and felt like I needed to spend time with them. So really any age, but not pediatric. I would say for me the ideal age is around 16, although the American College of OB-GYN says to start between 14 and 16 to establish a relationship.
It makes sense, yeah.
And then all the way through reproductive years and post-reproductive. So
that's so cool.
Well, we're running low.
I know. I was
we
like,
are.
oh no,
Yeah,
I can't believe that went by.
So,
Yeah, come on. This
Sure,
is Jordan,
come on
everybody.
over
Come on over
here.
here.
So when you say self-acceptance, what does that look like? Like I have a daughter who's 2 years old. She likes to look at her vagina sometimes, and my husband thinks that it's weird, but she's exploring her body the first time she saw it in the mirror. She so can
Just
you
curious.
talk to mothers with children? What does self-acceptance look like for? How can you give that to your child or for yourself? What does it look like? What does it mean?
wow, that's a big question.
Yes.
That could be a whole podcast
It sure could.
issue. But as far as your 2-year-old, I would say that that's completely developmentally appropriate. And for your husband, reading developmental milestones and understanding what is appropriate, then I think that might be helpful. It's hard because little boys who are 2, if they're playing with their penis, that's totally normal, right? Oh,
Yeah.
because it's right there and they can see it.
Right.
So
Right.
why aren't we allowed to look?
Right.
So I think also accepting whatever you have. Like, I'm short. Okay, I'm short.
Yep.
Yeah.
And you're 6'5". Well, I won't hold it against you.
Exactly. Yeah.
I remember the first time I tried to go to the bathroom like a boy.
Oh no.
Oh, yeah.
Well, I saw my
That's
brother
great.
do it, so I
Yeah.
was just like, well, why am I not going like that?
Yeah,
So,
I can't do that.
yeah,
Well,
you're
and
just curious when you're a kid.
Yes,
You know?
and when I see teenagers for their first gynecologic visit, you don't get a pap smear until you're 21 now, but we have a long discussion about, female anatomy, reproductive health, and everything, and then we do an external exam where I show them their anatomy and show them what's normal, because some girls don't realize that there's 3 separate organs down there,
Yeah, I bet.
like there's 3 separate holes.
Wait,
So-
you said they don't get an exam till they're 21, a pap smear?
Pap smear, right?
Well, why?
Because we found that we were over-treating young women. So if you have an abnormal pap smear when you're 17, most likely you're going to clear it and it'll go away on its own. So we were over-treating. We were being too aggressive, and that can cause complications later. So
Gotcha.
now we wait until they're 21,
There
which
you
is
go.
much better, because then it's, if you're a 16-year-old or 18-year-old girl and you've never been, it's not very much fun to have a pap smear.
Right.
Yeah.
Yeah. So, since we're running out of time, we always do a few fun questions
Oh,
just to
gosh.
find
Oh,
out a little
boy.
bit more about you as a
Lord.
person, as a woman.
Oh,
and
no.
Yeah. So, where's your happy place?
Where's my happy place?
Yeah.
I think I really like the beach.
Yeah.
Not any particular beach, but I love the beach.
I do too.
You
Yeah.
know.
Yeah, you do.
I love
for
the beach.
sure.
But
Yeah.
when I do hypnosis, a lot of times we'll use a place like that.
Mhm.
So I've come up with a beach that has a magic sand that doesn't stick to your feet.
Oh,
nice.
Isn't
That's
that
great. 'Cause people are like, "Ah."
It's magic sand.
Yeah,
Yeah,
that's
yeah.
great to do that in hypnotherapy because people take things so literally, right? And someone that has a hate of sand being on their body,
Exactly.
and you're
It's true.
taking them in through hypnosis, they can literally they can't concentrate on it because they hate sand so much.
Exactly.
So it's
Yeah.
perfect to
Actually, that
incorporate.
just happened
Oh,
with
did
a
it?
patient recently.
Yeah.
But and afterwards, she said that she hates that sticky sand on her, and I said, "Well, that's why it's the magic sand."
Magic
so
sand, that's right.
Yeah.
Absolutely. Who
So-
would play you in a movie?
I have no idea.
Oh, come on.
I really don't know.
Come on.
I really don't know. Give me a suggestion.
Um,
I'm the worst for that.
I am too.
don't know. I mean, I'm trying to think of.
Probably a gay man.
There you go. Gay man. Exactly.
Because I'm just thinking.
we'll talk about music. What's on
Okay.
your playlist right now?
Okay,
Gay
since
man.
you can cut things, my friends used
A
to always tell
petite
me I'm a
gay
gay
man.
man in a woman's body.
There you go.
What's on my playlist? Well, you know, this is not very hip, but I'm really into classical music.
Yeah.
Oh yeah.
So I
Nice.
love classical music, and that's what I usually play in my car,
So
and that's
cool.
in the kitchen
Yeah.
when I'm cooking, except for
Very
when my
good.
kids are around. So
Right.
I'd say right now I've been listening to certain pieces that I'm learning. One is the Samuel Barber Violin Concerto,
Nice.
Yeah.
and some
How cool.
other, you know, typical Mozart, Chopin, Bach, Beethoven, you know, all of those.
Very
are fun
cool.
too, so.
What is your most, not favorite meal you've ever cooked, but what is your most accomplished meal you've ever cooked?
Uh-huh. Actually, I can tell you that one because I do cook a lot.
Mm-hmm.
But one night I had a dinner party
Mm-hmm.
and I made Moroccan food, which
Oh.
is my favorite food, but it's very complicated to make. And we literally had 14 dishes.
Oh my
Oh.
gosh.
And my husband said that was the last dinner party we'll ever have because we were still doing dishes at 2:30 in the morning.
Oh, my gosh.
Exactly.
But that was, and I have a lot of, like, I have the Moroccan teapot and I have tagine pots and all that. So
Wow.
I really enjoyed that.
That is so fun.
Cool.
Yeah.
That was worth it to stay up till 2:30 or
Yeah.
3
Yes, yes.
doing that.
Yeah. So when she invites you over, be sure and ask her for Moroccan.
And ask her husband.
Yeah,
no,
there
we
you
are
go.
having Moroccan
Yeah.
food. Yeah.
So, go ahead.
There you go.
Well, I was just going to say, if someone wants to reach you, how should they reach you? Is there a phone number, an email, website?
Yes, and I would like to say that we do not have an automated system at my office, which I am proud of because I hate automated systems.
Okay.
However, if they're on the lines, it will send you to a recording. So our office phone number is 713-520-9580,
Okay.
and it's Karmel Women's Care with a K.
Okay.
And our email is Karmel Women's Care with no apostrophe, KARMEL Women's Care @gmail.com.
Love it.
Perfect.
That's
Yes.
perfect.
Yeah,
Good.
thank you.
You guys,
All right.
or ladies, not you guys, you
Gentle
people,
pe- gentle people.
Gentle
Reach
people.
out to Dr. Karmel. She has an amazing practice, and it's
Yeah.
worth it. Yeah.
And if
Thank
they
you.
want to reach you, Dr. Flowers, how do they reach?
Unreachable.
No.
jflowershealth.com.
Gotcha.
Yeah.
All right. Well, thank you so
Thank
much,
you.
Dr. Karmel.
Yeah. Thank you very much. This was so fun.
I know.
I
It's
love
fun.
it. Thank you, Jordan.
Bye.
I'm happy to talk to you more about all this.